We're in Khayelitsha at the moment at the Thusong Center that operated as a COVID-19 field hospital. Now it's officially being closed today after the last patient was discharged on Friday. There were just over 60 beds in the facility and 241 people were treated here and 34 people died. But the good news today is that the center is closing and the equipment and everything you see around here will be sent to other parts of the country, including KwaZulu-Natal and the Eastern Cape. To chat to us a little bit more about what this actually means to be closing a field hospital, we have the Premier of the Western Cape, Alan Winde, who is back in action again. Premier, thank you very much for joining us. We're glad to see you healthy again. Let's just start off there. You yourself had a brush with COVID-19. Can you tell us what was your experience like?
Well, I'm a diabetic as well, so because of that, everyone sort of freaked out and took a bit of closer notice of me. Luckily, I didn't have to make use of one of our hospital facilities. I was able to see it through at home, but it wasn't nice. And, so it's like flu and pneumonia. It just lasts a bit longer, or with me, it lasted a bit longer. And it also made my sugar go crazy. So there was a bit more focus. But it was also nice to test the system. I could get my calls from the system. Anybody with a comorbidity, we really zoom in and focus on them. And I could feel the same response. So that was pretty good for me to experience that. But back and strong and healthy again.
That's very good to hear. Congratulations. Premier, what does it mean that a field hospital is closing?
Okay, so I suppose the most important point is it must be good news. Although when I walk in here, it's almost sad to see this thing being broken down. But it's good news because it means that we've passed our peak. It means that the numbers are dropping. And, of course, this partnership was a great partnership with Médecins Sans Frontières. And, of course, they are taking this operation to the Eastern Cape, which is needed there now. And that's great. And we wish them all the very best. And if they can do and have the same achievements, I mean, amazing. So this hospital saw so many people coming into it, but so many people going home again, and that's really the message. Just imagine if it wasn't here. If we didn't have this hospital to respond, we would have been on already they were under pressure here during that time, but it's also amazing to know that was just 2.5 months ago, and we started with our first patients. We went through a really hectic time where these doctors were just day in and day out focusing on making sure we're saving people's lives. Right now, to be able to break it down again. So, I think that's the sort of position that our province finds itself in. And Khayelitsha itself, where we are now, it's also very interesting to see at one stage Khayelitsha was the second fastest growing COVID area in the Western Cape. And if you look at our dashboard now, you can see it's going right down. It really has got through the pandemic, and now we're going out the other side. But of course, there is still a message: masks, hand washing, social distancing, because we don't want a second wave. We need people to remain responsible, and now we need to get the economy going.
Talking about that, about the province, what does it look like for the province in terms of COVID infections? I understand it's just under 7,000 active cases across the province. But like you said there, we still need to be cautious here in the province. But what is the outlook for the Western Cape with COVID-19?
Correct. Okay, so obviously from my side, it's the positive cases that we look at. But remember, we still have a protocol in place that doesn't test everybody. So, those numbers don't necessarily mean accuracy. The real accurate numbers that I watch are the numbers of people in our hospitals. And our numbers are dropping. Also, again, in our hospitals, we're back to the numbers that we had in early June.
Meanwhile,